what patients and families tell me is that they would have liked more information about prognosis, because if they had known the prognosis days to weeks, weeks to months, months to years, they may have managed their life differently. They may have made different medical decisions. They may have said yes or no to different treatments. I think that's kind of the thing that a lot of patients and families tell me that would have been helpful to know. And I think that sometimes we as physicians may think that we've given this information, but it wasn't heard by the patient or family in the way that we might deliver it. And so there's this disconnect, this miscommunication around, you know, the doctor said there's nothing else they can do for me, but the patient and family hear that as, well, that doctor doesn't have any more treatment options, so let me go see the next doctor, right? So there's a disconnect there. So it's about the language we use and how we use it, and checking in with the patient and family. You know, what did you just hear that I said? What's your understanding of how long you have to live, or your disease, or those types of questions. My key takeaways for the students and learners that I work with are to first ask permission to have the conversation. So often asking the patient and family, is now a good time? Is there anybody else that you would like present for this conversation? Asking permission to have the conversation. And then once we're in the conversation, I ask how much detail do they want to know? Some people want to see pictures, some people want numbers, some people want, you know, what was the latest quote in the evidence that you read about, doctor, that says how long I have to live. So everybody's a little different. So I try to tease out what this patient or family want, how they want me to communicate with them. For instance, if it's a healthcare provider, they may want me to talk to them as a healthcare provider, or they may want me to use language that their loved ones are going to understand better. So I get permission, I ask how they want it to be communicated if they have somebody present, and then I ask them their understanding of their illness. So really they're the ones doing all the talking right now. I'm listening. I'm getting information from them about what their understanding is of their disease process. What have other doctors or healthcare providers told them? And then I correct any misunderstandings or summarize what they said if it's correct, and then kind of navigate from there. What else would they like to know? How can I help them move forward? What other types of decisions have the providers or clinicians asked them to be thinking about down the road? What are they worried about? What are they concerned about? And then I'll ask who would make decisions for them. Should they not be able to make those decisions? Going back to my philosophy that a living will really is just a checkbox list and a menu, and it's more important to have a loved one who you've designated who can make decisions in the ebb and flow of the medical world and be in line with your philosophy for life. And then I may ask them how they feel about other things like a natural death, or where would they like to die. I once saw this young man who was very clear to me. I had just met him, like we were 5 to 10 minutes into a conversation, and I'm sitting on the side of the bed, and he said, and just so you know, I don't want to die at home. I have 2 young kids. And he had thought this through, and I was like, wow, this man just told me, I just met him. What a privilege that he felt he could tell me all this. But I made sure that his primary team got all this information because he was at a point in his life where he wanted to make sure that somebody knew that he had thought that through, and nobody had asked him about it yet. And all it took was me just sitting there listening, and he launched into this whole plan that he had in his mind about how it should go down because he had 2 young kids at home.